When looking at the masseters, you want to take your non-dominant hand and kind of feel for the belly of the muscle. Clench for me. Good. So you can see her masseter. Literally. That's a nice masseter. So when looking, this is the anterior border. What you always want to remember is your risorius. So your risorius is your smile muscle. And your smile muscle is composed of multiple muscles, but you really want to watch for the risorius when treating the masseter because the risorius, smile for me. Good. And relax. The risorius actually inserts here on the anterior part of the masseter, and that's why that's so important. So you always want to stay away from there. Even if they say that this is where the most pain is, when they clench their jaw or anything, you never want to risk hitting the risorius. And you can kind of know that the lateral canthal lines, smile for me, is kind of the border that you want to stay away from here. So what we're going to do is stay posterior and stay deep. So your masseter muscle has a deep layer and a superficial layer. So that way when we inject, we're also going to retrograde a little bit so we hit the deep muscle and the superior muscle. If your patient comes back and has a little bit of bulging, you want to follow up with them in about 6 weeks because the masseter is so strong. It does take about 6 weeks to fully atrophy with the Botox. And if they come back and they have some bulging, then you can just add some units on the superficial layer here.